Previously on my channel I have posted a video about typhoid fever or enteric fever. If you would like to have a detailed explanation of what typhoid fever is, you can go and check out my previous video. Here we will talk about a typhoid case that we have seen in our hospital recently. It is a pediatric case. I would like to mention that typhoid fever is more common in the pediatric population, mostly between the ages of 5 to 12 years old, mostly male. It does happen in females and adults, but pediatric males between the age of 5 and 12, they are the most commonly affected ones. Patient was in his usual state of health 6 days back when he developed sudden onset fever, high grade 39.5 degrees Celsius, relieved by paracetamol associated with rigors and chills. Patient also complained of vomiting containing food content and non-projectile in nature. Patient also complained of abdominal pain, mainly at the umbilical area, and which later on became diffused, mild in severity. So the vital signs: pulse 94, BP 110/85, respiration 20, temperature 39.5, oxygen saturation 95%. He appeared lethargic and mildly dehydrated. Cardiovascular examination normal, respiratory system examination normal, GIT distended abdomen, non-tender, no organomegaly, CNS intact, GCS 15/15. So the differential diagnosis we managed to get were malaria, viral hepatitis, appendicitis, infectious mononucleosis, and dengue fever. Again, these differential diagnoses here that I have mentioned are most likely and most appropriate for the patient of this age and of this area. I didn't write anything about meningitis or any encephalitis because his presentation didn't show any symptoms or signs of increased intracranial pressure or neck rigidity or projectile vomiting or anything like that. So here I just narrowed down my differential diagnosis. So the provisional diagnosis we made was enteric fever. Actually, in these areas, typhoid fever is very common, and usually the diagnosis is made primarily on the clinical presentation of the patient. So what did we do for this patient? So the plan was, we ordered a chest x-ray, we sent baseline, that is CBC, liver function test, RFT, C-reactive protein, LDH, electrolytes, and vital test. And to follow blood and stool cultures, abdominal ultrasound, temperature chart, and to encourage oral feeding. Here you can see his chest x-ray. It was normal as expected. So what did the initial investigation lead? Ultrasound was unremarkable, no signs of cholecystitis. Urinary tract infection was ruled out. CBC was remarkable for moderate iron deficiency anemia, 9.3, which later on improved upon admission to 10. So his MCV, MCHC, MCH was normal. WBCs were normal. C-reactive protein was 142, which was quite high. LDH was high as well. Electrolytes, mild hyponatremia with normal kalemia. Again, hyponatremia is very common in patients who are presenting with typhoid fever. Liver and renal function tests were normal. So we took 6 stool cultures, and only one of them came out to be positive. And 5 days later, 3 out of 4 blood cultures were positive, and they showed sensitivity to all antibiotics, including beta-lactams, fluoroquinolones, and cotrimoxazole. Vital test was negative. Here it shows the sensitivity of various cultures and blood tests for enteric fever and how long after the patient has been infected that they would show there is a probability that they would show a positive result. So vital test is from 1 to 5 weeks. Bone marrow is 2 to 4. Urine culture again 2 to 5. Feces culture is 1 to 4. Blood culture is 90% sensitive between 1 to 4 weeks. So what we did for this patient while he was admitted under us, for the first 3 days we gave him Cipro 500 mg IV twice daily, and for the next days we gave him Cipro oral combined with paracetamol and supportive treatment. So the patient was discharged after 7 days in improved condition. He didn't have any complications, thankfully, and up till now the patient is healthy and he didn't face any relapse of typhoid fever. So this was a small case that I have seen in our facility, and I wanted to share it with you guys. Thank you, and please let me know if it was helpful, and if you would like to see any more cases, please subscribe. Thank you.